Hey everyone, today we'll be learning about pulmonary embolisms. Before you continue this video, I highly recommend you watch our other video on DVTs, as it will help you further grasp this oxygenation concept. A pulmonary embolism is a deep vein thrombosis that has traveled to the pulmonary system. Remember, a DVT is just another way of saying a clot is located in a location like a leg, and the pulmonary system is basically your lungs. So, a pulmonary embolism is a clot that has dislodged from most likely a leg and has now traveled to your lungs. When a clot travels to the lungs, it causes an obstruction, usually in a pulmonary artery, aka an artery in a lung. The most important thing you can do for a patient, besides prevention, is to be able to identify when a patient has a PE by knowing the signs and symptoms. Now, first thing I'm going to tell you, and if you remember one of these, I want you to remember this one, because the rest of the signs and symptoms all relate back to this one thing, and that is hypoxemia. Hypoxemia is a low level of oxygen in the blood. So I want you to think about why the oxygen level would be low in a patient with a PE. We already established that there is a clot stuck in the lungs somewhere and obstructing the path for free blood to pass through. So, because of this, the oxygen being carried by that free blood is not passing through either. Therefore, we not only have a low blood flow, but we also have low oxygen flow. The reduced blood flow is also causing dyspnea, which means shortness of breath. Why would the patient become short of breath? Think about it. There is a clump of blood in the lungs in the way of the normal blood flow. This will cause the blood flow to be reduced. And what does blood carry? Oxygen. And we use oxygen to breathe. If that blood flow is reduced, that oxygen is reduced as well, causing us to be gasping for more air. That reduced blood flow is also causing tachycardia. Because remember, our body is trying to make up for this reduced blood flow. Since not enough blood is flowing through the lungs, the heart is trying to help out by pumping faster in order to get that blood to move faster. Tachypnea. Think about it. A patient is not getting enough oxygen right now. So what's the common response when someone is needing more oxygen? Yep, they start breathing faster. Chest pain is also common because of the inflammation that is going on because of that clot. And last but not least, imagine someone who is unable to breathe, having sharp pain, their heart is racing, and they are trying to grasp for air. Wouldn't you think they would also be feeling a little bit anxious right now? Yep, anxiety might be evident as well. The main nursing diagnosis for someone with a pulmonary embolism is impaired gas exchange. This is related to decreased perfusion as a result of the patient not being able to breathe properly and not getting enough oxygen. Another nursing diagnosis is risk for bleeding. A patient with a DVT or APE will be put on anticoagulation therapy, aka anti-clotting medications. Because the body will not be clotting as well with these medications, the patient will bleed much easier as well. If you learned anything from this video, please give us a thumbs up and please subscribe to our channel as well. Thank you.